Literature Library.
Featuring me, the Lit Crit.
Hello and welcome to the Literature Library. Sharon, I believe you picked the article this time?
I did. I picked a cross-sectional validation study of using nerds and stones to assess bacterial burden.
Nerds and stones.
Nerds and stones is a mnemonic that is looking at clinical indicators in the wound bed to help assess infection. It was written by Dr. Kevin Wu and Dr. Gary Sybil.
Obviously leaders in the field of wound care research.
Absolutely are, and both of them very interested and involved in infection control management. It is available in Ostomy Wound Management's Journal, August of 2009 edition.
So, nerds and stonies. Let's take a closer look at that. And why don't you lead me through exactly this validation tool and what they used here?
Okay, I would be happy to. For the NERDS mnemonic, the object is to select at least the indicators that are applicable to your patient, 3 of them.
Now, these are clinical observations.
These are clinical observations, and the same with stonies. If you have at least 3 nerds or 3 stonies, that it could be indicative of nerds is for superficial, critical colonized wounds, and stonies is for deeper wound infections and your surrounding compartment.
So the patients are assessed. We look at them clinically. If they have a certain number of findings, they're classified based on this system. They're either classified as nerds or stonies. The nerds superficial, stonies deep, and that would obviously drive a clinical management algorithm. I would venture to say that the nerds could be managed with a topical approach, whereas the stonies require a more aggressive approach, maybe even parenteral antibiotics. Is that one of the take-home messages?
Absolutely. That's really one of the focuses and purposes of the paper, is to look at being sure that we are treating critically colonized wounds appropriately with topical management versus always treating these types of wounds with systemic antibiotics.
So can you define nerds and stones in a little greater detail? I mean, what are we talking here? Nerds is non-healing, exudative wounds, red friable tissue, those with debris and smell. Is that right?
That is correct.
How about stonies?
Stonies is more serious now, more serious types of infection where you have size increasing, you have change in temperature, you have os, which means you can probe to the bone.
Right.
You have new breakdown developing, you have edema, erythema, exudate, and of course, smell or odor.
And obviously, observations that would be consistent with a more aggressive type process, more aggressive infection. So that makes sense. Now, I see on the slide sensitivity and specificity. Now, they obviously made observations and classified these wounds and obtained predictive value as far as infection sensitivity and specificity. Now, Sharon, those terms, I've always been confused about sensitivity and specificity. Could you please review these definitions for me and for our audience?
Well, Jeff, I have a little bit better idea than that. Let's ask our literature expert.
Oh, that is a great idea.
Lit Crit, are you home? Are you out there?
Good day, Sharon. You appear to be puzzled. Do you have a question for me?
I do have a question for you. Thank you, Lit Crit. Could you help us out by defining for us what specificity and sensitivity mean?
These terms are confusing, but nonetheless very important to understanding the literature. Sensitivity and specificity are statistical measures of the performance of a binary classification test. Sensitivity measures the proportion of actual positives which are correctly identified as such.
Oh, excellent. Well, how about specificity, Lit Crit?
Dr. Nizgouda, I am surprised that you don't know these basic statistical terms. Specificity measures the proportion of negatives which are correctly identified.
Lit Crit, thank you for giving us this information. Now, you might be very intelligent, but I'll bet you were never, ever captain of your high school football team.
You're correct. I was captain of the polo team. Cheerio.
Polo team? Who plays polo?
I guess English people?
Oh, my goodness. Well, Lit Crit, you're very helpful. I appreciate that. I do. Thanks for helping us out to define those terms. So let's look back at the study, Sharon, and let's look at how they use the assessment tool to determine specificity and sensitivity.
Well, when they're looking at sensitivity and specificity, they obviously compared it to other articles that were in the literature. But they also looked at their own study and looked at how many of their patients that were in this study presented with 2 signs, 3 signs, or 4 signs, and those signs being those clinical indicators that you see in the wound bed that we discussed.
So by this assessment tool and the definitions that the lit provided to us, the specificity here increases the more signs you have. So the more signs that are positive, the more likely the wound is to be infected. That's very helpful.
It is, and it differs between the different parameters of the wound, but yes, some very good information for us to consider when we're doing our clinical assessments.
And correspondingly, the sensitivity is just the opposite. You see these numbers dropping, the more positive signs that are there. So this fits very, very well. Sharon, this was a great paper for you to pick. I think hopefully our audience agrees with you that these are things that they can take home with them and apply to their clinical practice. I would encourage you to read the article in its entirety. Obviously, we provide just a very cursory glance, an introduction to this article. Sharon, I want to thank you for that.
You're
Excellent
welcome.
choice.
Thank you. I was honored to do so.
Join us on next episode for more Literature Library.